This video is about some bones that you need to know. Keep in mind that some bones are part of the axial skeleton. Axial means head, neck, and trunk bones. Other bones are part of the appendicular skeleton. Appendicular refers to arms, legs, and their attachments. So bones that are attaching the arms or legs will be included in the appendicular skeleton. So keep that in mind as we learn some of these bones. The bone right here in your front, the frontal bone. In the back of your head is the occipital bone. So think of binocular, like ocular, occipital, like eyes in the back of your head. So frontal, occipital. If you have a headache, you rub the side of your head. That's where your temporal bones are. And then at the top of your head is a pair of parietal bones. Pair of parietal bones. The only movable bone in your head is your mandible, movable mandible. Above it, where your mustache would grow, is your maxilla. So mustache, maxilla. Your cheekbones are the zygomatic bones. Zygomatic bones. Beneath the zygomatic bone is a hidden bone, the sphenoid. Think of it as if it's seen, it's annoyed. So sphenoid. By your nose is your lacrimal duct, those are your tear ducts that come through your lacrimal bone. So to cry, lacrimal. And then behind your ear is the mastoid process. A process is just a part that sticks out of a bone. Going to the spine then, in your neck, the cervical area or cervical region are also the cervical vertebrae. In the front, there's a bone that you use to swallow. So your hyoid bone is associated with swallowing. It is not connected to your skeleton. The thoracic vertebrae are in your trunk. So think of trunk, thoracic. Think of lower back, lumbar. And then in your pelvis area are the sacrum and the coccyx, the bone you would sit on, your tailbone. In the cervical vertebrae, the top two are special. The head rests on the atlas, but it's able to rotate because of the axis. That little process that sticks up allows your head to rotate. Your clavicle is the most commonly broken bone. Your shoulder blades are your scapula. So think flat like a spatula, scapula. In your scapula, you have two processes. The one that's above, like an acrobat, is the acromion. The one that's below, like a crow's beak, is the coracoid. In your rib cage, your breastbone, think of a stern person poking you in the sternum. It's called the sternum. And then at the bottom of it, there's a process called the xiphoid. And if you're doing the Heimlich maneuver, you want to avoid the xiphoid. So think of avoid and xiphoid. Your ribs are three groups of ribs. True ribs connect from the vertebrae directly to the sternum. False ribs connect to each other first and then to the sternum. Floating ribs don't connect to the sternum at all. True, false, floating ribs. In your pelvis, you have three bones. Your ilium, think of it like that's the bones you feel on your hips. So think of yourself feeling ill, like in your stomach area. That's your ilium, like the hip bones. You sit on your ischium bones, and then in the front, where the pubic hair would be, is your pubis bones. In your arm, your upper arm bone is called the humerus. If you bang it, we call it your funny bone, but it's your not so funny bone because it hurts when you hit it on something. On the thumb side is your radius. On the pinky side is your ulna. Notice that little wheel at the top of the radius. It allows it to rotate. So think rotating radius, ulna on the pinky side, UP, spells up, or you can think of it as UP. So ulna to pinky side. Your wrist bones are your carpals. That's what you use to pull your car out of a ditch. Your fist bones are your metacarpals, and your finger bones are phalanges. In your elbow, you have a process called the olecranon, this part that sticks out that helps your elbow bend. The olecranon. Think of it like mashing old crayons with your elbow. Your longest and strongest bone is your femur bone. Your kneecap is your patella. So think to yourself, pat your patella. That's your kneecap. The bone where you get your shin splints is your tibia. And the bone beside it looks like it's doing work, but it's not doing a lot of work. It's fibbing you. That's the fibula. In your foot, your heel bone is your calcaneus. Think of it like calluses on my calcaneus. And then the foot bones are tarsals, like North Carolina, tar heels, but in this case it's tarsals. And then metatarsals, and then your toes are phalanges. And those are the bones that you should know.